Welcome back to Medical Monday. We're going to be talking about elbow pain. So this condition is very important because your elbow sits in the middle of your arm. So it's a joint that sits below another joint and above your wrist. So it's in the middle. So we oftentimes find is that it's like 3 times as likely to be injured because of all the other problems around it. And it just adds to it. So we're going to talk a little bit about what actually consists of the joint. What all is the joint itself? The elbow that moves our arm. So it is the bone right there in the middle.
Yes.
You have 2 bones in the forearm. That connect to your hand there. You see it. So those 2 bones are your radius and your ulnar. They create a hinge with your arm bone, which is we call your humerus, at the very top there. So you see how the arm comes down. The humerus is the top part of your arm. It comes down to your elbow, and then it splits off into 2 bones. And then, of course, we have the hand. So that sounds pretty simple, right?
It is. You would think
3 little bitty bones, right? But
that's just the bones.
What moves the bones?
What moves the bones?
Those ligaments, those tendons that move the muscles. It's very complex.
Yes.
We zoom into it here, and let's get a better look at what actually the joint looks like.
So this is more of the inside of the joint that we're looking at here. So this is the humerus, or your funny bone, as many people call it when you bump it. All right, so this is similar to the knee, and then it's rounded so that it can make this motion here. And then we have the ulna. Remember, that's part of the forearm. The ulna comes around and has a hook that actually allows that to stay in place so that we don't hyperextend or extend it past a straight line.
Some people do have what they call double jointed.
Yes.
The medical term for that is cubitus recurritus.
Cubitus?
Or we just say double jointed.
Or double jointed.
There you go.
Are you double jointed, Lonnie?
No, no, ma'am.
No? Okay.
No.
I'm not.
But the joint is moved with ligaments. So we have multiple ligaments in here because those 3 bones, as they come together, they have to be held very tightly. All right?
Yes, they do. It's similar to a cocoon. That's what I compare joint ligaments as well as capsules. Is they have to be encapsulated. They have to be encased in something so that the fluid itself can stay. And ligaments sometimes help in that process.
And then, of course, nerves run through your arm. That's why when you hit your funny bone, it's not very funny, but it is a nerve. That's where you get that tingling, that quick sensation, like a shock feeling.
Yes,
and that's because the nerve runs right through your elbow.
Right on the surface there, yes. The most superficial nerve in the human body is located in the elbow.
And that's why we hit it, and it's not funny.
Yes, it is. It is not funny.
But when you have problems with your elbow, there's a few conditions that are pretty common and a few that aren't very common, and we'll talk about those.
Yes, we will.
The number 1 common condition that we see with elbow pain is what's called tennis elbow. Tennis elbow is actually the lateral portion, which is the outside portion of your arm. Let's see here. Tennis elbow, it's well localized, but
typically, yes.
Typically, when you press on, you can actually feel it, and that's where that tenderness comes in. And it even hurts sometimes when you're shaking people's hands. Yes,
because that's part of grip, right? That's why when we talk about the shoulder, you know, the elbow's between the shoulder and the wrist. So where is it coming from? There's a lot of shared tissue here in regards to the muscles that work, you know, in many instances, all 3 joints or are involved in all 3 joints when we talk about the elbow. So there's a lot there.
Yeah. So besides tennis elbow, we got golfer's elbow.
Golfer's elbow.
It's actually not very common, but it's the inside part of your arm that you will have pain. It's about not as common, but about 90% of all golfers will actually have it. That's why it's referred to as golfer's elbow.
Well, that's what I was about to say. Apparently, it's common in golfers.
In golfers, yes, you're correct.
It is
but not everybody does golf. But we also see it in heavy lifters.
Yes.
So if you're working a job that requires a lot of heavy lifting, say you're a stalker at Walmart, and you're lifting many, many heavy objects over and over throughout the night, you will see golfer's elbow.
Yes, repetitious. So these tendons and ligaments that we talk about, they have protective areas that they're in. And so when we do something very repetitious and challenging, in the sense when we talk about weightlifters, they're constantly challenging themselves, maxing out is what it's called. You know, a lot of times that can turn into like a sandpaper-like feeling in that that tendon has to go through a very rough surface. It's not as lubricated or comfortable for them to continue to challenge themselves. They need to recover more and have that be more more easy, actually. Yeah.
So those are your two main common ones. We also have elbow swelling, which is not very common. You don't see that unless it's like trauma, a couple other things like gout, or if you have some bacterial infection in your blood called sepsis. Other than that, we don't see a lot of elbow swelling.
Typically not.
But the elbow swelling can limit your range of motion.
It can, right? Because if the elbow is swollen or the tissue around a joint is swollen, it's hard to move. And so specific to the elbow, when this area here swells, it's very hard to straighten it because of how that ulna is positioned with that hook shape. So you can't quite get it where it needs to go or do what it needs to do.
And that limited range of motion from the swelling we also see in like rheumatoid arthritis or psoriasis, and then you can actually see that with inflammatory bowel disease.
Yes.
Yep. That'll actually help or limit your joint movements because of that.
You are correct. You are correct there. Yeah. And then what, in regards to what we're talking about, right? Elbow pain. Some people never experience, or, they know they have an elbow, but it never affects them in any way. Where are these found most common other than in golfers and tennis? Golfer's elbow, there's reasons why those exist, but in regards to just every day, who is it out there that may not know that they have something going on
their elbow?
Yeah.
So,
or what's causing it?
Because the elbow joint itself doesn't deteriorate as much as, say, as the knee, because it's not weight bearing. So you don't see as much osteoarthritis with the elbow. What you do see is overuse injuries with the elbow, because weightlifters or laborers, somebody who's using their arms over and over, you're going to see this. And oftentimes, muscles only pull. Muscles only pull. So like if I lifted my arm out here, this is my bicep, it is going to pull my arm up. My tricep, which is underneath here, is going to pull my arm out. That's all muscles do, is pull. They do not push. But your back muscle there, your tricep, you actually see quite a bit of tendinopathy, which is pain within there with weightlifters.
With weightlifters.
Weightlifters, people that are using, see there you go. That would cause me pain just looking at it. But it's not just her form, which she's actually having an issue, but that muscle that she's using over and over with that amount of weight is not something you would naturally do, and that is why that muscle becomes inflamed, because it's not used to holding that much weight. Our bodies are built for certain things, and certain things are not built for, and overuse of heavy weights or heavy materials will cause that muscle to be a little bit painful and tender.
Yeah, absolutely. So repetitious, laborers, when you talk about that, any type of labor, or or do we notice it different in different areas?
We see it more in heavy lifting.
Okay.
So like say if you're working at a deli counter and you're going back and forth with the deli machine slicing meat, that's more of a shoulder issue. But when we see say you're outdoors and you're laborer, or say you're a landscaper and you're lifting heavy blocks or heavy bags of potting soil, things like that, that's where you'll see more elbow pain. More elbow pain with the actual heavy lifting.
Okay.
Because that is a medium-sized joint. It's not really designed for that much weight.
Gotcha. Like the knee, you mentioned that it's less common because knees are weight bearing, where yeah, all right, makes sense. Absolutely. So, when I was going through school, I worked for HEB. I loved it. And so, there was a lot of repetitious things that I did. And, anytime you have a heavy work day of any sort, even here in the office, you have to recover. So in these instances, I know for when my forearms hurt after a heavy day here at work and just a lot of patience, I like to ice and compress. Those are the things that I do at home to recover. And so with that, that's actually the home care that you can do to take care of your elbow, is you can get specialized equipment to help to assist and compensate for things for a short term in regards to giving you some relief and maybe get better sleep, things like that. And then same thing with ice and compressing it. We need to make sure that we reduce the inflammation in that area. So recovery wise, if you're a weightlifter, if you're somebody that, has a very physically laboring job and you have these types of issues, definitely feel free, or, use ice, utilize these tools at home to see if you can get the relief that you need. But in instances where that doesn't get me the relief that I need, Lonnie, what are some things that, standard of care would do if I went to my primary, or, even
So there's a lot of things that you can do before you go to see your primary. She talked about the ice. Now, ice is great. We see that in professional athletes all the time. They're icing themselves. Or you go to a very sports-related physical therapy place. They have ice baths. They have cryotherapy, a lot of those things because it helps decrease the inflammation, the swelling. Those muscles are not designed for that much load bearing, and when they have inflammation, they need to be calmed down. You need to calm that down with ice so that they don't have as much pain. But if going through what you've tried at home, through your ice or compression, and you need some help with something, you come see your primary. You come to an urgent care, you come to anybody who's going to help you get out of pain. That's the name of the game. Well, what we utilize to get you out of pain is medications. Yeah. Medications are very widely used for pain. There's multiple ones. We have a large category, which is the most prescribed medications out there, are non-steroidal anti-inflammatories. Those are great for helping bring down that inflammation. If the ice is not working for you, those will help. But then, of course, we can also move into some other things. Yeah. So
I know that one of the things that I like to do, or that I've seen used, is topical rubs.
There are a ton of topical rubs out there.
And I know there's prescription rubs.
Yep.
And then there's also, if you're looking for other alternatives, is just over-the-counter type drugs like you're talking about.
Voltaren gel used to be a prescription drug, which is kind of like liquid Motrin, which was great because it only worked into the area. It didn't go throughout your body. It recently became available over the counter.
Wonderful. Yep. That is great. I love it when resources like that change. I know we recently did, while we were doing research for this presentation, we did a Google search. We like to do our Google searches.
Here we go, the Google.
And do you remember the number? Do you remember the number for the
So we originally did it like a week ago or a couple days before. It was 680 or I wrote it down.
Yeah,
I think 680.
680,000 topical runs whenever you Google topical medication for elbow pain. And then I did it a few hours after that, and it was 692,000. 692,000.
So within a couple hours.
Within a couple hours, it increased by 12,000. 12,000.
That's crazy.
Absolutely.
So needless to say, there's a few topical creams out there.
Yes.
Be mindful of those. Get with your primary care. Get with somebody that's very knowledgeable, can help you so that you're not wasting your time and money.
Yep.
Both of those are very important because you need to get back to doing activities. Oftentimes with elbow issues, it is soft tissue. Soft tissue is those muscles, ligaments, and tendons, and they need to move. Part of the healing process is moving.
It is moving. It's very important. Movements, Lonnie mentioned that our muscles pull, right? Our muscles pull our bicep and bend our elbow. And then our other muscle back here, our tricep, pulls to straighten our elbow. Well, the other thing that our muscles are pumps. And so movement is so important in the sense of pumping our blood, not just our heart. Our heart is a muscle and a pump as well. But our skeletal muscles, our muscles that allow us to move, are very important for pumping blood back to the heart. So keep in mind, movement is very important. Even when it's painful, do the movement that you can do. Absolutely. That was a great point. And then also, I talked about at home, there's compression areas or straps that you can use to help to alleviate some of the symptoms, especially when there's certain things going on. But then there's also more advanced ones.
Like an offloading brace.
Correct, like an offloading brace. And so there are more advanced offloading braces that are available for elbow type pain, especially for athletes, more athletic based if you're seeing an orthopedist. So that's definitely something that is standard. And then also rehab.
Yeah, that's the movement right there. You've got to do sustained, supervised movement so that you don't cause pain.
Yes, yes. And a lot of times we do have to figure out where are my limitations, because if you don't know where your limitations are, you're like, no, my workout's great. Look what I'm doing. I'm doing my workout. It doesn't hurt. But then when you go do the proper movement or the proper form, you have to take that step back sometimes to make sure we're getting the movement we need. Yeah. And then a lot of times here in the office, we see patients that end up getting the steroid injections. Very, very common. Actually.
Steroid injection is very common, oftentimes utilized for the elbow. It's a very easy injection, but it is a very thick substance, and most patients do not like it. But it does relieve the pain. It does help get them back to being more active, which is what you want to do with this. But with any steroid, we always want to be careful because there's a couple precautions with that. All steroids decrease your immune system, and they also increase your blood sugar. So somebody who's older, maybe immunocompromised, we want to be mindful of, along with somebody who's diabetic. We don't want to increase their blood sugars.
Yes, and those two are very important. As well as we've talked about this in the past, the steroids are great to get you relief very quickly, but they also give you a false sense of hope. So if there is a problem in there, that's something that hadn't been seen before or isn't known, the steroid injections, they're great to give you the relief, but then you keep pushing through and it ends up in the long run causing more damage because you think things are okay.
Yep.
All right, so we've talked about a lot of different things in regards to the elbow. We talked about the anatomy, the function, a lot of things that cause the pain, some of the things they can do, you know, in regards to at home, and then also going to their primary. So what are some things that we can do here in the office? What are some things that we specialize in here to get our patients and our audience back to where they need to be?
Good question. There's a lot that we do here, and a lot of it focuses around the muscles and kind of how do we get that movement and what movements are needed for this. A lot of it's physical therapy.
Yeah.
You know, those muscles need to move. You talk about the pumping action. They need to get back to moving so that they can not only pump the blood back to the heart, but also increase that capillary blood, which is the small blood around the injury, so that it can bring your own body's healing into it. Within your own blood needs to be in that area, because that's where your own growth factors, that's where everything that you need to actually heal a wound is contained. It's within your blood.
Absolutely. Wonderful. All right. And then also adjust. You know, if it's a movable joint in the body, it can be adjusted. And so the elbows, although very simple, can sometimes be very complex and uncomfortable to adjust. And many times due to that, you know, it's just because of the tissues around it, as well as, is it coming from the wrist? Do we need or the shoulder? So some cases actually, we adjust the entire area, the shoulder, the elbow, and the wrist itself. And patients get phenomenal results with that, especially once we get past that initial discomfort that appears when I like to describe as poking the bear, right? We poke the bear here in the office.
It's important to always remember, I know baseline of my medical training, it was always not just specific to where the pain was, but the joint above and below. Anytime you work with musculoskeletal issues, i.e. joints, you always want to assess the joint above and below the joint that's causing the patient pain, because oftentimes there's related issues, dysfunction between them. So it's always important to not only focus on where the point pain is and the point discomfort, but the joint above and below. And it's great that you guys can adjust everything within that arm to really help the patient.
Absolutely, it does, and it gets phenomenal results. And some other things we can do here in the office, and I know you're phenomenal at it. I know you've done TPIs in my shoulder before, but TPIs, the trigger point injections,
trigger point injections,
great to help reduce inflammation.
The University of Michigan Family Medicine department actually noted that trigger point injections were the #1 relief for this type of issue. So anytime you're having some taut tissues, really tight point tenderness, whether it's in your forearm or even a little bit further up into the large part of your arm, those muscles help move the elbow, and those muscles can become tired and very tight. So it's like a tight rubber band that's almost at its breaking point. What you want to do is relax it with trigger point injections. Great option, very low side effects, because we actually use an all-natural 13 botanicals. It's like a natural Motrin. So it's like liquid Motrin we inject right into the muscle. But anytime we're injecting, we always include a couple of numbing medications. Like, you know, when you go to the dentist, they numb your teeth or your gums. That's just for comfort.
What's that?
Yeah, we'll just you could do a YouTube video about all the people coming out of the oral surgery. I see them.
Those are fine.
But your arm's not going to feel that way. But
No,
it will help numb a
effect.
little bit, and then we can actually take care of the muscles.
Yes. And I can tell you from experience, these trigger point injections are phenomenal at getting some relief when needed. Absolutely. And then one of the big things that I love, and most of our elbow patients go through, is PRP.
PRP.
Yes.
Platelet-rich plasma, so is one of the first developed regenerative medicines in the world, okay? And we really focused on it here with high-end athletes. The last conference I was at and talked about, it was an international conference, and the team doctor from the New York Giants, the Red Sox, or White Sox, it was multiple ones there, but they all talked about utilizing platelet-rich plasma to keep their high-end athletes who have elbow pain, shoulder pain, on the field, because they need to heal much faster. But it's very affordable for normal people like us. It can take care of that elbow pain very quickly because it's your own blood. Platelet-rich plasma is your own blood. We draw it and concentrate it, and then utilize, as you can see this picture, this is actually an ultrasound. So we utilize ultrasound so we can get to exactly where that pain is. And your own blood has its own platelets, its own growth factors, everything that we concentrate in there to help you heal at a much faster rate.
Yeah, because when we get the platelet-rich plasma, it's the white part of the blood. It's the healing properties of the blood is what we utilize to inject into that site. I know we've had quite a few patients over the last few weeks come in with elbow pain, and fairly quickly recovered in regards to getting that relief. And many of them were weightlifting athletes, and then also, you know, laborers in regards to construction. I know you mentioned
some
soccer,
baseball players.
Baseball players.
Just activity in general. You know, those joints are you know, utilized, and the small tissue that move those joints can become irritated. And to get back there as fast as you can, whether it's especially a labor, if you're needing to get back to work, you want something fast. You don't want to go and rest for 4 to 6 weeks. You know, you want to get back to it as soon as possible.
Yeah, absolutely. So that is elbow pain, everybody. We tried to condense it as simple as possible, to be honest, because there's just a lot. Even though it's a very simple joint, it's very complex in everything involved, the wrist, the elbow, the shoulder. There's a lot there. So we do hope you enjoyed this material. We absolutely love doing Medical Mondays, and look forward to many, many more.
For many more.
Yes. So without further ado, you guys have a great day, and we'll see you next week.
Next week it is. Bye.